Thank you so much.
Bye.
She's off to check the mole behind her eye. It's like, I don't think. Angie, don't go be looking in mirrors or out like that.
I hate these conversations because I'll be at the opticians tomorrow.
Yeah, I know. I know you've got health anxiety, but don't go Googling now either. It's the worst thing you can do.
I try. Yeah, I keep away from Google now.
Yeah, please do.
Yeah.
And all specialists will tell you the worst thing you can do is Google anything. And dentists for me. Oh, I don't mind dentists. New story.
Does anyone else do this? You know, when you Google something, like you Google it, say you got headache, it's like you're looking for something bad on the Google. It's like, okay, it's not that.
Yeah, but if you're looking for it, you're going to find it, aren't you?
Bad, sorry. I mean,
you're going to bypass all the positives and then see that one negative.
Yeah. What I mean is you Google to look for the positives and you come up with all the bad ones.
Yeah. If you're going to Google anything, always go on the NHS site. That's the best place to go. Never go on any other sites.
Yeah. Google
don't go on any other sites. Dr. Google is the worst. Don't use it. Hi, Lottie.
Hi, Malik.
Hi, Malik. Sorry, I don't know how you keep on getting dropped. Yeah, just be careful on what you Google.
Yeah.
Finger slipped.
Absolutely. Do you have your mammograms, Blaster?
No, because I had my breasts removed, I no longer need a mammogram, but I do have to have like my chest cavities checked and things like that. And my lymph nodes, I had a lot of lymph nodes removed, but the remaining ones I do have to have checked as well.
I mean, can I ask you a
Not
question?
much you can do after you've had them, yeah.
Yeah, you don't have to answer this, but I was just going to say, was that because you had the gene or it was just because you had the cancer?
No, I had the cancer, but I also carried the gene as well. So I was going for yearly mammograms because of my the gene I carry in my family's history. And then they found cancer, so that's why I had to have the mastectomy. What
about the hysterectomy? Did you have that as well?
No, I had that because it was a completely different procedure and it was for completely different reasons. But if I had known, it was about 7 or 8 months before I was diagnosed with cancer. But if I had known then I had cancer, I would have had my ovaries removed. Unfortunately, I've still got my ovaries.
Unfortunately.
Yeah. Once you have a hysterectomy, if they leave your ovaries shrivel to the size of a raisin. So they're very hard to find. So they have to go through and it's major surgery to try and remove them.
Oh, is it?
Yeah.
Yeah. Did you have chemo as well when you had cancer, or my mum? Oh, right, no, my mother.
No, I was very fortunate, very lucky.
Yeah, I think my mum had radiotherapy.
Am I going to address the elephant in the room, Blaster? What's that? Is it because you're the size of an elephant? No, babe, I'm not. So off you go.
What's the elephant in the room?
I've got no idea. No idea. Yes, but don't Google anything. Don't Google anything. You'll just make yourselves worse. They're on about... I don't care who they're on about. I'm having a hysterectomy. Honestly, it'll be fine. I was up and out of hospital within 24 hours, back on my feet.
Were you?
Yeah, after 24 hours. Yeah. I had 4 little incisions and then back out. Mind.
It's amazing what they do these days, isn't it? It's amazing.
It is now. Yeah, it is now because about 10 to 15 years ago, you were sliced open. Sorry, everybody to use that word, but it was very, very bad then. But now it's keyhole, isn't it?
Is it keyhole now? My mother was sliced out. You know, she was open. I'm pretty sure she was.
Yeah, it's a keyhole now.
Really? That's brilliant then.
Yeah, do they still put you to sleep? Back on my feet.
Do they still put you to sleep?
Yeah. I mean, you can opt for an epidural if you want to. But yeah, they do give you a general anaesthetic.
I suppose it depends where the lump is, though, isn't it? With the cancer is, because not everyone can have that keyhole.
Oh no, I'm on about the hysterectomy with my with my mastectomy. With my mastectomy, it was you were told you couldn't even lift nothing for 12 weeks. But I'm that sort of person where as soon as I come out, I'm lifting everything, and I displaced this one. So this implant turned, so it was flat. So I had to go back in and get it put back in with some mesh inside. Oh, look at them.
Oh, aren't they cute? Oh, look. Oh, they're adorable.
Over 10 years ago, hysterectomy was out. Yeah, a lot of people were opened up for major surgery then. Oh, look at them.
Aren't they? How many are there? Looks a lot there. A lot of kitties.
She is very beautiful. Malik, how many? 5 kittens. Someone said 5 kittens.
She's a good mummy. Yes.
Oh. So pretty. So precious.
Yeah.
Bless them.
5.
I'm really nervous about mine. I have to have a total hysterectomy. Even if you have a hysterectomy or a total hysterectomy, it's still the same. They're still going to go in the same incisions, and they're still going to remove the same
Were
things.
you
I
scared,
had my-
Master?
May?
Yeah, when you had to have
Nah.
that. No.
No, you see, stuff like that doesn't bother me. I'm a great believer in whatever you've got going on in life. There's nothing you can do to control it. So you either run around it, which you can't, and then try and avoid it, which you can't, or you just go straight through it. So I chose to go straight through it and worry about it afterwards. Blaster, have you already been through the menopause? No, I'm going through it now. Wee devil, it's horrible. It's one of the worst things I've been through is the menopause. Gonna pop up and ask about HRT. You can do. Yeah, just request, babe. Hiya, Savage. I'm going through menopause too. It's not nice. Give me a bit.
I appreciate it. Thank you. I do have a couple of
You're
questions.
right.
Yeah. It's just that now Angie might be able to help me with this as well, because I mean I'm perimenopause, but I had to go sort of through the same procedure as what Angie did, and you get given like a small percentage of HRT pessary that you have to use.
Yeah.
But it made me lose the plot. I couldn't use it. So my question also to you is, how do you get on with it? Also, because obviously you've had breast cancer, etc., and
Yeah.
it does run in my family. So have they said it's safe for you to use, or?
No. Obviously there's when you go through the menopause, there's 3 hormones that your body starts lacking, and your ovaries stop producing, which is testosterone, estrogen, and progesterone. I'm not allowed to take the testosterone. I'm not allowed to take the estrogen. I wouldn't be allowed to take the progesterone. I wouldn't be allowed to take the estrogen either if I hadn't had a hysterectomy. But because I've had a hysterectomy, I don't have a lining of the womb.
Okay.
So I'm allowed to have the estrogen patches. The pessaries or to me, they don't work. They don't work. And there's a lot of people on here, they say they'd take anything. There is the likes of fluoxetine and amitriptyline that can help with the likes of hot flushes. So if you don't want to go through the HRT route, there is an antidepressant out there that does work.
Yeah,
and there's I'll find out the name of the drug as well, that that's really good for stuff like this, but it's private. It's £60 a month, which is nothing if you're going through something like this, but it doesn't work for everybody.
I mean, I'm permanently at the point now. I've got 2 fans on me today, and I'm constantly. Well, you know what it's like when you get the flushes. It's horrible.
Yeah.
And I'm permanently drinking ice drinks just to keep myself cool, because I can't cope with it. But I don't know if there's any like alternative rather than going down the HRT, and I can't have amitriptyline because I have bad side effects with that. I'm at a loss of words, to be honest with you.
Fluoxetine helps, but there is like black maca. There's vitamins and supplements called black maca. There's all sorts you can take that do help.
Why can't you take pessaries?
Because it made me absolutely Iricidal.
can't have HA.
Iricidal. It's
Yeah.
that's what it may be, and it was only a small percentage that we, as you know, Ange, because I know you were having to use the pessaries. I don't know whether you still do, but I just can't take it, and I do have liver issues, so it doesn't process properly with me as well.
Hey, yeah.
Yeah, you
just a
can't
quick,
take them if you have liver. Sorry, Willow. Go ahead.
that's all right. Just a quick one. I've been told to have evening primrose oil, and it has stopped my hot flushes at night. So it's just a
Yeah.
simple one that you can use, and that really did work for me.
Okay.
Yeah.
So I'll give that
I
a
was
go.
going to say that I had ovarian C, and I'm not allowed any estrogen anywhere near me, and I have to take tablets that kill off any traces of it. I am on venlafaxine, which is a antidepressant, but it has side effects where it is used to control hot flushes in people that can't take hormones. So that might be something for you to go and ask your doctor about, to try it. I'm only on a low dose, but
Does that not knock you out with venlafaxine? Because I've been on that, and it used to make me like so dizzy, if that makes sense.
Maybe, but I mean, the other stuff I take makes me really tired anyway. But I'm only on a low dose. I think I'm on like 75 milligrams or whatever, and I think it does help. I wouldn't say they've gone. I still suffer from them, but it's not as bad as it used to be by any stretch. You might want to try it.
I think it's an individual thing, isn't it? What works for me or what works for CG might not work for everybody else.
Yeah.
So unfortunately, it's a case of trying what you can to see if it works for you.
There's another thing I think
sent a
called.
list.
Sorry.
It's all right.
I'm really bad at talking over people. There's another thing called oxybutynin or oxybutin, I think, that I trialed.
Yeah.
That could be something that you could try. That was from a specialist menopause
Yeah,
consultant.
if you've got fatty liver or anything like that to do with your liver, you can't take that either.
Oh, can't you? Right, okay.
No.
I like to say it's trial and error, because everything works for different people. And even though people are saying that venlafaxine causes sweating, it's found that it's like a weird thing that it can do. It can benefit hot flushes in some women if you can't take estrogen, so it's worth asking.
Yeah, it's individual basis, isn't it? But I want to try and go down the holistic route, but also again, you've got to check with the holistic route whether it's going to interact with medications you're already on as well. I just can't take the hot flushes anymore.
They're debilitating. They're horrible.
Yeah,
thanks, Blaster.
Like I say, no, you're all right. Try black maca or sage or something like that, and that's more holistic. Can't even get my words out. That if one doesn't work, the other one is bound to work. So try that.
So it's called black maca.
Yeah, you can get it on Amazon.
I appreciate that. I'll do a little bit of research into that, and see possibly if I can take it, because I'm at a lost cause at the moment. And to be honest with you, the doctors aren't that great. They're just like, well, you're going through perimenopause, this, that, and the next thing, and it's just like, get on with it. Do you know what I mean?
Yeah, perimenopause was hard, but see, with the full blown menopause, that's no, I wouldn't wish it on anyone.
No. God, I'm not looking forward to that bit then.
No.
Blaster, I'm only coming here really quickly because you've got an account in the comments which is cloned my account, goes around trolling me on other people's accounts. So it's not got a heart next to it, but it's in the comments. So I just wanted to let you know. I don't know if it's still there. It was there a few minutes ago, but
Marcus, if any of you in, can you block the fake delusive account that's going round, please? Thank you.
Thank you, Blaster.
No problem.
Well, I'm going to drop, but thank you so much for that. And please,
no,
ladies,
you're welcome.
Get yourself checked. Check your breasts. Make sure you have your cervical smears, and check moles, because it's very important. Extremely important. But anyway, thank you so much, and
you're welcome,
yourself, ladies. Okay, take care.
And you.
Bye.
Take care. Bye. 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 I wake up like a tap is running under my neck. There's some really good. There you are. How sad that you have to copy someone's account. You're now blocked. A lot of people mock going through the menopause. They don't realise how bad it is.
Hi.
Oh, yeah, you're right.
Blaster. Yeah, I was just going to say never Google anything because I've got dilated cardiomyopathy, and if you Google it, it says I've got 5 years to live. Well,
Oh,
I've
shit.
been going 7 years now, and I've just last Friday went in for a new box changed to my heart. It's got a defibrillator in there, and a 2-wired pacemaker that pumps my heart 24/7. And I am still going 7 years on. Just had a new
Oh,
box fitted. Not pleasant operation, but it has to be done. And
yeah.
I've got that keep me going for another 6 years, and then in 6 years' time I'll go back in for another box. So
Oh, good for you.
I would never Google anything, because if you Google dilated cardiomyopathy, it says at top you've got 5 years to live.
Yeah. No,
And
I don't agree with
that's the
Googling
same.
anything.
And I go through the menopause, and I am not joking, Blaster. I'm on a pump gel, because the patches just slid down my leg in the night because of the night sweats.
See, the
So-
patches stick to me, and I don't know why, but the patches are really good. They do stick to me.
Because
But I
of
do
heart
forget to put them on.
problems, at night, the outline of my body on my bed through the menopause as well is only from my knees down. But I've got really skinny legs, so they're not filled with fluid.
Right.
So
Yeah.
the patch used to just run straight down my leg and ends up by my ankle by the morning. So I got
Oh.
this pump thing, and then I have to have 2 of these jelly thing tablets at night, and they now put me on Clonidil or something for the night sweats.
Yeah.
And about 3 days ago, I ran out of medication for them, so I didn't have no medication for 3 days, and I've not had a hot sweat. So I'm stopping it. I'm stopping the
You-
pump. I'm
Have
stopping.
you tried them cool cloths that you wear and they stay really cool for
Yeah, I bought some
for
off
half the
TikTok
day?
Shop. And
Yeah, I've tried
I know
them.
this
They are
sounds
good.
stupid, that sometimes I sleep on a like a dog's cooling mat.
I did as well.
I sleep on that, and but when the hot sweat wakes me up because the bed's saturated, but I'm freezing, I'm shivering.
Yeah.
I have to blow a hairdryer on me for me to be able to get out of bed because I'm too cold.
See, it's the opposite with me. I'll be sweating, but then I'm boiling and I can't cool down.
No,
And then I'll
I'm
touch
cold.
anything cool just to get that cold surface.
Yeah, I get really cold when I wake up, and I got the hairdryer plugged in by the side of my bed because it's that frequent. I get up, I blow dry myself so I feel hot
Yeah.
before I strip the bed.
Right. Somebody said you need your thyroid checked. I've just had a load of blood tests.
I've just had,
Mine's
yeah,
all right.
I've just obviously I got heart problems, but there's other problems as well,
Yeah.
and they've been checking my cortisone level. Is it cortisone level? The blood test has to
Yeah.
be done by 9 o'clock in the morning, and that seems abnormal, which can affect your mood swings and muscle cramps, and so yeah. I don't know what they'll do about it, whether it's another tablet. I take 23 tablets a day,
Bloody
and I just think, oh, another bloody pill to swallow,
Yeah. And I think with some tablets, as soon as you start taking some, you're having to take other tablets to counteract the side effects of the tablets that
Yeah.
you're taking.
Yeah. And obviously a lot of the heart medication I take every day, I'm sure that's got an effect on my body.
Yeah.
I don't really know, because I'm 57, okay? I'm 57. I've not had a period since, for about 20 years, I'd say. So I can't see that I'm still in menopause at all.
Did you go through the menopause prematurely?
Yeah, what happened was years ago, I want to say about 18 years ago, I was 20 stone and I had a gastric band fitted.
Right.
Okay, I went down to 7.5 stone. Couldn't even sip water, and all my electrolytes were out of balance and all stuff like that. So I went into hospital and had it removed because I'd got so thin and I couldn't even sip water. I'd sip it and it would come straight back out. And that's what's caused, because yes, I got dilated cardiomyopathy, but it has caused heart failure stage 4. So there's nothing more they could do for me, because unfortunately I can't have a heart transplant because I've got kidney failure, I'm diabetic, and I got COPD. So they won't give me a heart transplant because ironically it's got to go to someone healthier who's going to get maximum benefit out of it. But the box is keeping me going, the medication is keeping me going. They class me as stable, and yeah, like that's all they could do really, is just keep changing the box and the medication now. But never give up. A mammogram. You said about your mammogram and that.
Yeah.
I'm 57 and I've never had a mammogram.
No, please.
The reason they won't do it is because of the device I have fitted inside me. They can't do a mammogram.
Yeah, anything that's got the tiny little bit of I don't know when you had that fitted, because a lot of it's titanium
I
now.
had it fitted 2019. I would have been 50.
Right.
So
is there no other way that they can do a kind of mammogram on you?
I don't know. They are looking into it,
They
but
can
this
do
is 7 years
They
old.
can do ultrasound scans. So ask if you can be booked in for one of them, because they can normally pick up anything in that as well. And if there's anything there, then they'll do biopsies or core biopsies.
Because I don't feel no lumps or nothing, but my twin sister, she's had 2 mammograms, and I'm like, well, I've not even had one, and that's the reason why. It's like I'm waiting for an operation on my nose, but no one will put me to sleep.
Yeah, I think it's the risks, isn't it? Obviously, it's complex with you. So the risks of putting you under general anaesthetic outweigh probably the benefits of you having that surgery.
My cardiologist said it needs to be done because it's affecting me more than my heart, my nose. And then I had to go to the ENT. The ENT referred me to an anaesthetic man. And he said it was down to him if he's willing to put me to sleep. And luckily, he's agreed to put me to sleep.
Right.
Now hopefully this year it will be done.
Yeah.
And I've not breathed through my nose since 2019.
Oh. So just ask how long does menopause last for? I'm telling you now, I was shocked when I went to a specialist. She said that she's even got 80-year-old women that's still coming into clinic with mild symptoms.
I hope I don't have these night sweats.
Sorry, can I just jump in for literally 2 minutes?
Yeah.
Mr. and Mrs. 80, when you were saying that you had your gastric band put in, I had a gastric bypass done, and I went from 20 stone down to, I was 98 kilos, and I've now gone down to 55 kilos.
Wow.
And I had the same thing that you had, where I couldn't even drink a sip of water without throwing it back up again.
Yeah, it's
So
terrible.
for anybody who's considering having a gastric band or a bypass done, think very, very carefully, because it can have lifelong consequences, and they don't tell you that. When you go for your surgery, they don't tell you that. It has, however, gotten rid of my diabetes. And I was on 3 insulin shots a day, plus a different one during the weekends.
Thank you, Alex, for that.
And plus also medication throughout the day. So it's gotten rid of that. It's gotten rid of my blood pressure. So there are pluses and minuses for all of that. But the last thing I just want to say is anybody who's going through the perimenopause and is at the beginning of their menopause, there is a herbal tablet out there called Menopace, and it's by a company called Vitabiotics. That saved my life during perimenopause and the beginning of menopause. So it's called Menopace. It's Menopace, Menopace, and it's by a company called Vitabiotics. You can get it in any chemist, and Amazon do a really good deal on them. If you're at the beginning of your menopause journey, and if it's something that you think may work for you and it's holistic, please, please, please try it, because it really did work for me. And I was going through the most during my perimenopause and the beginning of my menopause. I'm 7 years in.
Always check with your
Yeah.
GP first before taking anything, even if
Yeah,
it is
absolutely.
supplements or herbal.
Absolutely. Check with your GP. And as long as your GP is okay with you taking it, and if you're somebody who doesn't like taking chemicals, putting chemicals in your body, and your GP okays it, try it. And if it works for you, fantastic. If it doesn't, stop it. It's like any of these, black cohosh and sage and everything else. I tried all of those. None of those worked for me. This worked for me. So I'm just putting it out there because I think a lot of people don't know about it.
I've just ordered the Evening Primrose, what that lady said, because that's the only one thing I haven't tried.
Evening Primrose. Yeah, I tried that as well, and it didn't do anything for me. So I did a lot of testing and trying, and none of it worked for me. And then I stumbled across this, and I went to my GP and I said, not ready to go on the patches because I have a history of breast cancer in my family. I don't want to do the HRT. I don't want to do this, that, and the other. Can I try this? She looked into it and she said, yeah, it's absolutely fine for you to try. And I went down that road, and it was fantastic. However, like I said, take it, with a proviso. It may not work for you. And like the blaster says, check with your GP.
Yeah.
Check with a pharmacist. Check with anybody who will know, rather than just taking it. And I'm now on HRT patches because it stopped working for me as I got further into my menopause. And I'm now on HRT patches, which I've got to be careful about as well. I've just had a mammogram done, which has come back all clear, thank God.
That's good.
And, just be careful. Just be careful. Check your breasts. Have your mammograms done. If you can't have your mammograms done, ask them for the ultrasound mammograms. They can do it. There are ways around it.
Yeah.
And, take care of yourselves, because there is nobody else on this planet who will take care of your body the way you will take care of your body. There's nobody else who gives as much of a damn about your body as you do. So make sure that you look after yourself. And that's all I wanted to say. And hello. Sorry, I didn't know somebody had sent me a gift, but whoever that was, thank you very much.
I think that was Alex.
Oh, was it Alex? Hello, Alex. Thank you, darling. But yeah, just look after yourselves, ladies, because you have to. And Blaster, much love to you as always.
Thank you. And you.
All right, my darling. Take care. Bye.
And you. Thanks, babe.
Bye, love.
Bye.
Thank you, Pastor, for having me in. And,
You're welcome.
You take care. I do watch you all the time. And
I feel sorry for you. I seriously feel sorry for anyone.
No, I do like it. And when you actually kick off, oh my gosh, I'm like,
no,
go blast.
I do need, you know what it is? I am watching things back on the FYP and I am cringing. The things that I come out and say, it can be horrible. It can be vile. And I think, oh my God, why? Because they're on there now forever.
I'm not like that. I have been all my life. Let people walk all over me. Do you see what I mean? And it's only been the past 2 years, I think, that I can flip. They diagnosed me with EUPD because I can't stable my emotions. If I feel a doctor is overruling me and I lose control, that's it. But that's
Emotional
the only time I flip.
personality disorder.
Yeah. It's not that often. It's when I lose control. of a situation,
Yeah.
which isn't very often because obviously I live a very peaceful, peaceful, and I have to pace my life. So yeah, it's got quite an easy life, I could say. Difficult, like obviously having to give up work and stuff like that because I worked in the community caring for people, and then I had to have carers in myself. You know, it was weird, but
Which must be a lot for you to accept because it's kind of where you've reversed roles, haven't you?
especially when the first carer come and it was one of my best mates from the care company, I was like, oh my God, if I got to get naked and get in the shower in front of you, oh my gosh, I feel, ugh. And she said, it's fine, Julie, we see it every day.
Savage. Yeah.
So, you know, it's true what Queen, I didn't catch her second name, but it's true what she says, you know, women have to really look after their bodies and, you know.
Thank you, Savage. Don't take anything for granted.
Yeah, and if you go to the doctors and you feel that you're not listened to, get a second opinion.
Yeah,
you know,
I was just going to say that. Doesn't matter what doctors, or even if it's a consultant, specialist, always ask for a second opinion if you're not sure.
Yeah, 100%. Anyway, Blaster, take care. Bye, Malik.
And you. Thank you.
Paula.
I wish you all the best, and
I
I
will
hope
be
you
in the
get back from them
comments
soon.
listening.
No problem.
Right, I'm going to try and kick myself once.
If not, let us know and I'll help you.
Okay, let me see. I need help. Oh no,
I'll do it for you. Have you done it? There you go. I've done it for you, babe.
Hi, Bless you.
Hi,
All right,
Paula.
Not
Yeah,
too
not
bad.
bad. You?
No, not too bad. I heard you saying about they've left your ovaries. That was the same as me. I had a hysterectomy. I had to have it after I had my last daughter. It was an emergency because I couldn't get the blood stopped. They said to me, have they left your ovaries? And I went, I don't know what they've left. I said, it was an emergency one. So every time I go to the doctors now, they go, have you still got your ovaries, Paul? Well, I don't know. It should be on my record. But I was on the patches, and the patches was making me really itchy. So I'm on the gel pump now. I've only just started, but it seems to be doing good. But I want to ask as well, I hope there's not many in here. I have an overactive bladder. Now, I had the tablets and they didn't do any work, anything. And then I went through and had Botox in my bladder. And it stopped as well. But now I'm getting a simulator, a bladder simulator. Has anybody ever heard of it?
I've heard of them. I don't know anyone who's had one, but I have heard of them, and it's where it stimulates your bladder to make you go to pass urine, or it can stop your bladder from passing urine. So if you've got an overreactive bladder, it'll help you pass urine and give you the feeling where you need to go and pass urine.
Yeah.
And where they slow the simulator down, it can make you feel as if you don't need to go and pass water all the time.
Yeah.
Because Botox in your bladder doesn't last long.
Well, how long have I had it now?
Someone just said don't try and overshare everything because you know what this app's like as well. But if we can help, we will.
I forget how long I have. Must be a few years now that I've had Botox in the bladder, and that was the best thing I ever had. And it's just a pity it stopped working now. But this is the next one. The thing they're going for is a simulator.
It could be linked to the menopause. So go back to your consultant and ask them if it's
a mesh put in, and the mesh is now. It's going to. I don't know. It's going to sound stupid here. It's curling up on one side now. So if to go,
is that like a ventral mesh?
It's just like a sling, basically, to hold your bladder up.
Yeah.
So to go, I don't know. They're planning to hopefully take it out because it's just curling up now, so it's no good. But it's on my left side, and it's really sore to touch, and if I bend down, so my doctor says that's what it could be. It could be the mesh. So
it could be that, depending on when you had it done, because I know they use Braxton mesh now, don't they? Which is completely different to what they used to use years ago. That's what I've got in my breasts.
Yeah.
So when they removed my breasts, I didn't have any breast tissue. So to fill them out, they use Braxton mesh.
Right.
So instead of it being just normal mesh, it's made out of something that's very similar to human skin.
Yeah,
and then it grafts onto your skin and it produces collagen and fatty tissue. So it depends on what mesh you've had inserted into your body.
Everybody's asking about the bladder Botox. Yes, it is a thing, ladies. And if you have problems with your bladder, I would recommend it now. That's just it worked for me, but it's just I got it done twice before, and I got it on Friday, and it hasn't worked. It's just completely stopped working for me. But it did work for me.
Yeah.
The mesh I have holding my bowel up is made from pig skin cells. Oh goodness, never heard of that.
That's it. That's a ventral mesh retropexy. I know all about that. Well, everybody, I am going to.
Nurse, you should.
Who, me?
Yeah.
Nah, my days are gone now. These conversations are really eye-opening. I've been told to have Botox on my face for my skin condition. Depends on what skin condition you have. To be honest, best thing I've had for overactive bladder. Does bladder Botox hurt? I've never had it, JD.
It's just they sort of numb you down there, and they don't give you sedation. Unfortunately, I just take the gas and air because I hate needles, and you can feel the doctor sort of getting out of your bladder just to put the Botox in, but no, it doesn't hurt.
I don't know how numbness of my lips has turned into different lips. I really don't. My lives just go way off. They really do. I do apologise. Hi, Robbie. I do apologise. Sorry?
Helen says she gets put to sleep for her. I know, I don't. They won't put me to sleep for some reason. They just numb me down there, so they do. Well, they did with me.
I had the camera in my bladder once, and I says, "Is the camera big?" And he went, "No, no." And they picked up this machine and went to pass it over my head, and I went, "Oh my God, that's huge!" And they went, "No, that's the camera machine." And I thought it was like that. I thought, "Oh my God, how are they going to get that up there?"
Maria, tell me that. That's what I have to go and get on the 23rd. I'm dreading it.
Oh yeah, but it's only the size of your little pinky, isn't it?
Yeah.
The real camera. It was the camera box with the batteries and everything, and that I thought that you were shoving up there.
What else women get through? I said to the doctor last week, my own GP, I says, "Doctor, tell me this." And she says, "What?" And I says, "Why is it called menopause when women go through it?" And she says, "You're asking me, Paula." She says, "I don't know." How do you go about getting blood? Jenny Marie, go and ask your doctor. Just say to your doctor, because it was one of my consultants. Yeah, just ask them to refer you for it. Because I was on tablets, and the tablets didn't do anything for me. And then it was one of my doctor who retired now, and she says, "Oh, I think we need to go down the Botox." And I went, "I don't need Botox." And she went, "No, Paul, you can get it into your bladder." And I went, "All right, okay." But it is good. It has helped me through the time I had it, but it stopped working, unfortunately, now. But I'll let you go, Blaster. Thank you very much.
Thank you. Hi, Irish girl. Well, much love to you all. I just thought I'd quickly jump on, show my face, check everyone's all right. I will be back tomorrow, and we'll have a longer live. Love, come up and talk about my 2 cervixes. I'll you know what? I'll hold a live about people's conditions, ailments, or whatever they're experiencing. I'll do that. I don't know, Blaster, I hope you're doing. I'm well, thanks, Kirsty. That was great. Lovely. Thank you, Nick. Yes, goodbye, everyone. Much love to you all, and I shall be back tomorrow. I'll hold a longer live tomorrow. I just wanted to quickly jump on and see everyone. I'm going to go and make a phone call about my lip. So even when I go out, I can't feel it. Love you all. Thank you very much. Malik. Much love.
I love you. Thank you so much. Thank you. I love you.
And you. Much love.
Shukran. Bye.
Bye.